Hello and welcome back.
Hey, good to be here.
Thank you. I'm happy to have you.
Of course.
And I see that you are in a new location. Are you
Yeah.
in a private location today?
Yes, I am.
Okay, great. You'll have the privacy that you need to feel comfortable talking about your healthcare for the next 20 to 30 minutes.
Yeah, I'm at a friend's house, but I'm in a room. There's like a door. It's private.
Perfect, perfect. And how did this last week go?
Oh, it's been just fine. It's been like, I mean, finding housing has been a difficulty. If I'm being perfectly honest, I'm like lucky to be staying with my friend right now. I'm kind of just like couch surfing on their, oh wait, technical issue. My headphones are dying.
Oh no, that's okay. That's okay.
Just a quick pause. Let me switch up the sound. Can you hear me? Okay, I can
I
hear you.
can, okay, great.
Um, yeah, so I'm staying with this friend. I I don't know, I don't remember if we talked about this before, but like I had been like living in my old place and not paying rent because of the like rent strike and protections that were around in COVID, but now our landlord just evicted us because those rent protections have ended and I lost, they kicked us out. I've been living there for like almost 4 years, but we lost the place and then had to give us like a hard eviction notice. That was a few weeks ago. And luckily I've been staying at my best friend's place, which has been, I don't know, it's been good and I'm like really lucky to have them, but it's also been a little difficult because it's like, they're my best friend, but I'm like, shit, like am I overstaying my welcome here? Like what's what's the deal? Like what's going on?
Yeah,
And yeah, I'm trying to get myself together and like find a new place, but yeah, it's just a little tricky.
thank you for sharing all that and being honest. I really appreciate just like all the details that you provided, and I
Mhm.
can really hear how urgent and important this is to you. Would you like to spend our session today talking about housing and resources?
Yeah, that would yeah, what kind of resources are out there that might be helpful?
Yeah, we can talk about resources and just kind of how you're processing everything that's happening and how you're taking care of yourself while it's happening.
Yeah.
Um, I also wanted to check in. I know with this new development in your housing and being evicted, perhaps it's been a little tougher for you to stick to your sleep hygiene goal that we talked about last session.
Yeah.
Yeah, how did that goal go?
Oh, that has been good. I have been drinking, I've been taking like a half calf, you know, um yeah, in my coffee and not being so caffeinated late in the day.
Mhm.
So yeah, that I've been like noticing to do and making sure I do that every time at work. And my sleep has been a little bit better, but it's yeah, I think it's just impacted sometimes by my schedule being a little different than my roommate or my friend who I'm living with, who's now my roommate. Like I get in kind of late, and she heads out a little early, and I'm kind of like on the living room on the couch right now. So, she's gotta like, she's like, I'm like, someone can't like not have breakfast in the morning and like get up and
Right.
do make some noise in the morning. So that's sometimes like wakes me up and it makes it a little hard to get my full 8 hours sometimes. Yeah, but I was able to I feel like going to bed has been a little bit easier.
And so just implementing some of the small steps that we talked about, practicing drinking less caffeine later in the day, doing your half calf. Were you
Hmm.
able to take a look at the resources or any of the sleep apps that would help with like guided meditation?
I downloaded the sleep app. I did. No, I didn't. I didn't have a chance to try it out though. I like have it on my phone. Um, and downloaded it while I was at work after our session. But I can try it out this week. I haven't really needed it for going to bed, but
Okay, yeah.
um,
And it's just,
I think if I have another moment where I'm like restless and like having racing thoughts and can't slow down, then I'll have it there. I just need to set it up and maybe explore it a little bit.
yeah, and no rush. It's exactly like you said, for a time that you think you may need it. We're going at your pace and what you feel you need. And so it's an option for when you think you might need it, but really up to you.
Okay.
It sounds like the half calf and less caffeine later in the day is really working for you for now.
Yeah, that's helping.
Yeah, good, good. Um, okay, thanks for sharing that. And then again, I just like to check in before we uh, dive into our topic for the session. Checking in on the WISE app and how's that? If you've been using it, or if you have any feedback on it.
It's been great. Like everything with it has been just fine. I've just been using it for I get the notifications from it for the medication
Yeah.
reminder.
Okay, great. So your medication reminder you're finding helpful.
Hmm.
Yeah. Okay. Thanks. Um, And again, thank you for sharing everything that you are. It's an incredible opportunity to help others your age living with HIV. So we really appreciate your time, and um, we can definitely talk about housing today. What do you think would be most important or most helpful to talk about when we think about your housing?
Um, well, right now I'm like just looking for an apartment, though the tricky thing is just I'm like, is there any rental assistance available? I was kind of curious about that. Like, I mean, I'm still working my job, so like I have some income, and stuff. It's just a question of like finding something that's affordable and where it's like not too far from like a BART station so I can get into my work. I don't have a car and I don't drive. And yeah, that's just the question of like finding apartments. And I've been looking a little bit on Craigslist and stuff, and I've but most of the places on Craigslist, I would need to like get together with a group of people
Mm.
to like rent a new and sign a new lease. And I don't think I think more looking for like a room right now would be the best thing.
Yeah. And why does a room sound like the best thing for you?
Oh, just because like signing a new lease and getting everything started up, like I've never done that before, and I think I would like I don't have enough money to have a one bedroom. I could looked at some one bedrooms. That would be nice. I would love to have my own spot. But I've
Yeah.
looked at some one bedroom apartments and they're just like way too expensive. Like I was looking on Craigslist the other day for stuff, and it was just out of their price range. So my friend was actually suggesting that I like look and see if there's a room on rent with like more people because having roommates is just, a way to reduce my rent.
Yeah. So I heard that just it's more affordable for you to rent a room. It
Hmm.
also sounded like you've never had your own one bedroom. Maybe it sounded a little overwhelming, or signing a lease was, what was it?
I mean, I'm into like having my own space, and
Mhm.
my own kitchen, my own bathroom
Mhm.
that I'd be into, but like it's like the what is it you have to pay?
And so the move-in cost for the deposit, first month's
Yeah,
rent. Yeah.
yeah, like that. And
Mhm.
like, they want like your credit score to be really good, which I don't even know what my credit score is.
Mhm.
Yeah, I'm just like that, yeah, that part of it, I guess, is like I'm like, what? Like that's yeah, I don't think that would work out for me.
Yeah. So because of the credit score, I guess like the requirements overall with moving costs, you feel like you wouldn't qualify for a one bedroom.
Yeah, that's what I was kind of just like I guess I don't really know, but like yeah, that's kind of what I was imagining like what was it? I'm trying to remember when my last place like the last place I moved in as like I think I was on the lease but as like a subtenant
Mhm. Mhm.
or something like that. I don't remember. It was 4 years ago.
Yeah.
But like all the like and I had to pay a little bit of a deposit down when I moved in. Um, but I don't think I had to do a lot of that other stuff. I don't remember.
Yeah. It was a while ago. A lot of
Yeah.
details too.
Yeah.
But it sounds
Yeah,
like it was
seriously.
easier than what you're kind of like thinking, or easier than the process you're thinking of right now.
Hmm.
How do you think this apartment search is impacting your mental health and daily life right now?
I mean, it's stressing me the heck out. I'm
Mhm.
like, you know, I just feel like I'm not sure. It's kind of like this like background thing that I need to do that's like resting in the back of my head. And it's yeah. I mean, my friend was like, "Oh, you're definitely good for the month, but it's already been like 3 weeks now." So at first I was like, "Oh, a month, like great, it's plenty of time to chill." But now I'm like, "Okay, a week left," and I've gone to see a few places, but and like sent some texts out to friends to be like, "Hey, does anybody know of a room that's opening? I'm looking," but I just like haven't heard. I was hoping I would hear something back from that. And now it's like it feels like it's time to like scramble.
Yeah. So it was really stressful. And you said that the search was kind of in the background. Maybe
Mhm.
the stress kind of
Yeah.
kept you from taking the action you needed because it was so
Yeah.
stressful.
Yeah. I'm just hoping that it will work out, that like something will come down the
Yeah.
line and I'll just like, someone will respond to the text and a place will come through in my rent range. And
Yeah.
yeah.
How has this been impacting your HIV care, if at all?
Um, I mean, I don't think it really has. It's like
Mm.
I can still make it to my appointments. I haven't had one recently, and I getting my medication just fine. I just get it from I still go to the same pharmacy to pick it up, and they can also do like mail delivery and change my address to deliver it there. So, I mean, I've got my meds, I'm taking them.
Yeah.
Um, yeah.
Okay, you sound really on top of it. And I asked that question because sometimes the stress or our mood can impact our memory or even our energy levels. And some folks can forget to take their meds or just put it in the background too. And
Yeah.
our mood and it can shift and priorities may change during times of stress. So just like to check in and see how that's going for you.
Yeah, I mean, it's definitely like stressful and a little chaotic.
Yeah.
But I've got my the reminder on the phone has helped with the app, honestly. Because even though my stuff is like not in the same place it was and everything like that, and I had to like get rid of a lot of things when I had moved out, like I just have that
Sure.
reminder that my medication. Um, yeah, and that's been fine.
Okay. Is it okay if we explore some of these resources now? I can tell you about some more emergency resources and then some more long-term resources that you can connect to.
Yeah, sure.
Okay. I heard that you have 3 weeks left out of the month that your friend was going to provide for you.
Oh,
Um,
just well, I
oh,
just
I'm
have
sorry. No,
one
you've
week
been there
left.
3 weeks. You have 1 week.
But
Sorry.
I can probably stay longer or try to stay with another friend.
Sure. Okay. And just as a resource for you to have in your back pocket and think about, or even maybe sign up for, have you heard of PRC?
No, what is that? What is that?
Yeah, PRC is an organization that serves folks living with HIV only. And so they're funded by Ryan White Funding. And then if you go there and you sign up with them, they will ask for your letter of diagnosis. So if you
Oh,
can get that from your like social worker, you can sign up with them. They have what's called an emergency stabilization room, and it can help you with a single occupancy room or like a hotel room that you can get for 2 weeks. And after 2 weeks, if you still need a place to stay, you get an additional 2 weeks. So it's a month that they will pay for you to stay in a room in a hotel somewhere in downtown San Francisco.
oh, okay.
It's not the nicest room, but it's an option. So I like to present that in case folks are kind of in dire need and don't really have anywhere to go.
Okay, shoot. I mean, I was hoping to stay out of an SRO. That's
Yeah, I know, I
they're
know.
chaotic.
They
They're
are.
chaotic. I mean, I've been in an SRO before, and it was just like I was like, whoa, this is. I hope
Yeah.
I don't end up staying here.
Yeah, and so just an option, right? It sounds like you have friends that are willing to help you out. And also, there are resources in the city that can help folks living with HIV, specifically with housing vouchers. And this is something that I feel like your social worker or caseworker at your clinic may know more details about. So really asking them too if they have any information that they can connect you with. Um, but for instance, the mayor of San Francisco's office has a specific program for folks living with HIV
Okay.
for housing. There's
What
also, oh,
what did what do you get with that program? Is it
yeah, so it's because you're working, uh, they'll give you more info too, and I can send you more info, but
oh,
it's an income-based voucher. And I'm gonna pull it up if you just give me 1 minute. Tells me that's how people. Um, it's the Plus Housing Waitlist. Oh, sorry, this one is for folks who are unhoused.
oh, okay.
Sorry, unhoused, and let me see if they have. I'll send you a list with more details so we don't spend a lot of our time talking about looking up the details.
Okay.
But there are specific wait lists, housing programs, and also if you find a place on your own, PRC will help pay some of those move-in costs. So they'll help you with deposit,
Oh,
first month's rent, last month's rent.
oh,
Again,
okay.
yeah. So, and have you heard of coordinated entry?
No, I have no idea what that is. What is that?
Yeah, San Francisco has like a central housing system for folks who are unhoused. And if you don't qualify because of your income, or say you're working and you don't qualify for some of their services, they also have move-in assistance, move-in cost assistance to help people get into homes.
But I wouldn't qualify for that.
Oh, no, I guess like if for folks who are unhoused and have no income,
Okay.
they qualify for like different services than folks who are unhoused and have some income.
So I might qualify for some services.
Yes.
Okay.
Yeah, yeah, depending on your income. Um, and so just reading up on these resources, knowing what's available. And also, how do you feel about talking to your social worker and caseworker at your clinic, if you have them?
I mean, I actually don't have one right now. I'm going to the AHF clinic in San Francisco, and they don't, um, I was never assigned a social worker there.
Okay. Yeah, you can always ask if your care team has wraparound services or if they have a social worker on your team.
Okay.
And they would connect you for sure if they did.
Okay. Yeah,
Um,
I didn't think to ask them about anything aside from like my meds, but I can ask them about that.
Yeah, and they provide more like case management. They can help you more in the community. Where here I'm providing you information about the resources. They can help to make that connection and make it a little more smooth for you.
Okay.
Um, do you have any questions about anything that I just shared?
And I just, if you could send me the information about that. What was the organization? I think it was the PRC to help with like
Oh,
move-in costs.
yeah, PRC will help with moving costs, the emergency stabilization room, which like needed last resort.
Okay.
For 2 weeks at a time, up to a month a year. PRC has many different resources for in different like areas. So they have resources if you needed them for any like legal or medical assistance. They would be able to help with that.
Hmm.
Obviously, the housing and moving costs. They also have vocational services. So
Mhm.
if you wanted to reach out to them, they have a vocational training workshop every Wednesday. But I'll definitely send you their
Okay.
info.
Okay.
Um,
Yeah, I'm good on this job for now. That's
okay, and
problems
so
with my
that's,
boss aside, that's at least lucky.
sorry.
Problems with my boss aside, that's at least lucky.
Oh, yeah. Um, and so HOPWA is the other one that I was thinking out, housing opportunities for people living with HIV. Um, Catholic Charities has a subsidy too, for folks who are working. You
Okay.
pay a certain percentage of your income. And of course, these are more long-term solutions, getting on these wait lists, but it's a starting point to accessing some of the services.
Okay. Yeah, it would be, I'd kind of like totally ruled out the idea of getting a wood bedroom, but like the initial payment, I think the only thing would then be like getting approved by like a apartment or a landlord and
Yeah.
getting in. But yeah, if I could talk to someone more about that process, that would be helpful.
Mhm. Yeah, because I'm sure the questions that are coming up for you have come up for others with these subsidies or assistance before. So I am certain
Hmm.
that they can provide you with more answers.
Okay.
Um, and what would you change right now if you could change anything to help you with your housing situation?
Money. If I had more money,
Yeah.
that would maybe if I won the lotto, I wouldn't have so much trouble with my housing situation. Is that not a good answer? Should I like
No, that's fine.
a
You more
different?
income. That's
Yeah,
very real. Yeah. You need resources to
right.
make
More
things
income.
happen.
Yeah, higher paying
Yeah.
job.
Yeah.
Yeah.
And what do you think is like getting in the way of earning more income or helping you get or take that next step for more income?
I don't know. I don't know what I could do. I mean, I've just like always worked in I've just been working in like cafe jobs and like service industry stuff. I mean, this job, I like this one because they give me healthcare. That's good. And I don't want to switch because of that. And I don't want to like lose my my healthcare and like be able to like go to the doctor and stuff like that. And this cafe had like healthcare benefits included, which like not all of them do.
Are you
Yeah.
familiar with ADAP, and the different insurance coverages that are out there that can help you with your copays, or even like your
No.
premiums for healthcare as well?
No, I maybe I've heard of that. I don't know. It kind of sounds familiar, but I don't think so.
Yeah. ADAP has different programs, one of them being that they'll pay for your HIV medication.
Hmm.
They'll also help pay for your premiums with different healthcare plans. So
Okay.
I can send you more info on that, and also your social worker would be in your clinic or just asking your clinic for more clarity around how ADAP works. Even, sorry, I'm getting really excited now. PRC has
Okay.
more information around insurance and how they can help pay for the different costs, just so you don't feel like you're tied to one place of work because of your healthcare, just so you have that information.
Okay. Okay. Yeah, that would, I mean, that would maybe free some stuff up because I feel like I've kind of been, but that's one of the benefits of this job is that I do have a plan with
Yes.
health insurance. But wait, what is it? Would I be able to like get a plan not through my job if I got a new job?
Yeah, I think it depends on the job and the different healthcare plans that they offer, or if you don't go through your job. ADAP can help fill in the cost for like those premiums. So those monthly premiums that
Hmm.
are really high for some folks to pay.
Okay.
ADAP can help with those premiums so that you are covered through insurance.
Okay. Hmm. Yeah, I guess I should look into that. Because yeah, I mean, I feel like I've heard about people making more doing bartending. So like, on tips, like you get more tips than you do in like a cafe job as a barista, while the like wage pay is about the same. So I could like switch into
Mm,
bartending and maybe make some more money.
mhm, mhm. Um, and for now, as we think about your housing, is there any goal that you think that you'd like to make um, towards housing or getting your own place
Um,
that you could work on in the next week?
I
Sorry.
mean, yeah, I'm just like processing a lot of the information still. I was thinking like my next step in my head was to like try to find more places that are listing where like houses of people are listing like a room, you know, like do another deeper search on Craigslist of places that are just like a room available in a house and maybe go like like send some more emails out like that to try to find some good places. And also someone was telling me to look on like forums, and then I deleted my like Facebook, but I remember that Facebook had like a bunch of housing groups where people would
Mm,
post
mhm.
like LGBTQ housing and stuff like that. I don't want to look through those and see if there's like rooms available in places.
So continue your housing search and sending email inquiries.
Hmm.
Okay. And how confident are you that you will um, that you'll start your goal, I guess we'll say,
Yeah, I
in
mean, I'm
this
feeling
next
pretty
week?
confident. I've got like a
Yeah,
week
yeah,
left, and my friend was also like, "Hey, like, how's it going? Like, what's up?" Um, the other day, and I was like, "Oh shit, I need to like look some more." So that kind of it's pushing me to look into it some more.
yeah. So on a scale of 1 to 10 on the
It's pretty,
confidence rule.
I feel like a 9, like I feel pretty confident.
Okay. And what's one step that you'll take? I
Um,
heard you say,
I'll check Craigslist
yeah,
again.
check. Okay.
Um, and I don't know, I'm like, I don't know where to find more information about these or any other sites aside from Craigslist that I should be checking.
Yeah, Craigslist. I can see if I can find some as well, and in addition to the resources that I'll send
Yeah,
you through the city and county of San Francisco.
yeah,
Um, I'll also see your for roommate specific situations you're saying,
yeah,
right? Yeah,
yeah,
yeah, I
room
can send you
situations.
those. Yeah, I'm happy to do that. Um, do you have any questions or feedback so far?
No, um, I guess I should also like, it seemed like there was a lot of things at the PRC, so like maybe I should also reach out to them.
Yeah, that's a great goal. We can add that into your goal for this week, checking out PRC.
Yeah,
And just remember, they will ask for your letter of diagnosis. So I don't know if you have one handy or if you can reach out to your clinic. Maybe that's a good
I can get
goal.
that. I can
Yeah.
get that from my doctor. Yeah, I
Okay.
actually might is a digital copy okay? I think I might have a somewhere in like an old email or something.
Yeah. Yeah. It should be in my experience, but you'll
Okay.
confirm with them. I've, yeah. Okay. Well, thank you for sharing what's been going on with you. And I know that it's stressful, but it sounds like you have some support from your friends, and you're feeling really confident about continuing your search, and you're open to resources. Um, I
Yeah.
guess, what's one thing that you look forward to in the day, in the midst of the stress and
Oh, um, I'm looking forward to getting off work.
yeah.
I haven't gone in yet, but I feel like I'm already looking at getting off.
And having your Lewis time.
Yeah,
Yeah.
exactly. Exactly at the end of the day.
I hope you enjoy it and have some good time off.
Yeah, thank you.
Thank you. Um, I really appreciate your time again, and we'll see you next week. Does this time next week work okay for you?
Yeah, it says.
Okay. Thanks, Lewis.
Thanks, Remy.
Talk to you soon.